Hello students, today we will be dealing with a management of newborn based on the Apgar Score rating. The Apgar Score was developed by Dr. Virginia Apgar in the year 1952. Is a quick and effective method used by medical professionals to assess the health of the newborns immediately after birth. The scoring system evaluates the five keys. Those are the appearance, that is the skin color, the pulse, which is an heart rate, grimace, that is responses, that is reflexes, activity, muscle tone, and respiration, that is breathing effort. Each criteria is scored on the scale from 0 to 2 with the maximum possible scale score of 10. The Apgar score is typically measured at 1 and 5 minutes and even after 10 minutes after birth, providing critical information about the newborn's physical condition and guiding any necessary immediate medical intervention. Scores between 7 and 10 generally indicates that the baby is in good health, while the lower score may signal the need for a medical support or further evaluation. Today we'll see the management of babies based on the rating of the Apgar score. So last class we have dealt briefly about the Apgar and its scoring. So the babies with Apgar score of 7 to 10. The baby usually looks pink, breathing regularly and heart rate is more than 100 beats per minute. So what's the management for the normal scoring of 7 to 10? The oropharynx and the nasopharynx are to be cleared of any mucus by suction. Oxygen is administered if required only. The condition will be reassessed again after 5 minutes, and if found normal, the infant should be given to the mother, and as a routine care will be given to mother initiating the breastfeeding. The Apgar score, the baby's score is between 4 to 6. The component is the peripheral cyanosis will be there and the breathing will be irregular and the heart rate will be less than 100. So what's the management you are going to do with the score of 4 to 6? Baby may follow primary apnea. Place under a radiant warmer, dry the baby. The baby is put flat or slight head down position with the face on one side to facilitate a gravitational drainage of fluid from the respiratory passage. Immediate suction of the oropharynx and nasopharynx is done either by the mucus sucker or by suction apparatus, which is mechanical or electrical, whatever is available. Stimulus to be given to the back and the sole by gentle rubbing. Simultaneously, oxygen is administered at the rate of 5 liters per minute by bag or mask at a pressure range of 25 to 30 cm water. Intermittent positive pressure ventilation is given if necessary. The support should be continued until respiration is spontaneous and the heart rate is more than 100 beats per minute. Such an infant may be acidotic, but it is corrected spontaneously after the respiration is established. In majority of the cases, the baby takes independent respiration with this simple measure. The Apgar rating is done again at 5 minutes and if found satisfactory, the baby is returned to mother. But if the above measure fails, that is secondary apnea, oral suction followed by tracheal intubation is done. The tracheal tube is connected to the resuscitation bag through which oxygen is administered at the rate of 5 to 8 liters per minute. Intermittent positive pressure ventilation is maintained at the rate of 40 to 60 per minute. Gentle external cardiac massage is performed if the heart rate is less than 60 per minute. When there is history of administration of central depressant drug such as pethidine or morphine which has been given to the mother during the labor within 3 hours of delivery, suitable antidote example naloxone hydrochloride 100 microgram per kg IM single dose may have to be repeated. Babies with the Apgar score rating if it is below 4, that is central cyanosis, the baby is not breathing and the heart rate is below 100. In such case, the management is the tracheal intubation and intermittent positive pressure ventilation must be started immediately. In such circumstances where arrangement for the intermittent positive pressure ventilation cannot be made, you have to give mouth-to-mouth respiration as a life-saving measure. For circulation to maintain, the cardiac massage has to be given. And later on, the baby can be shifted to the NICU for the advanced procedure like intubation and ventilation which will be carried out. So these are the ways how you are going to manage your baby after rating the Apgar score, that is in the labor room immediately after the birth of the baby, which is assessed at 1 minute and again repeated at 5 minutes, if necessary at 10 minutes also you can score the Apgar score as rating, and based on this Apgar score you have to manage the baby. Thank you. Proper management and interpretation of Apgar score are crucial for ensuring the well-being of newborns. Healthcare providers must quickly and accurately assess these scores, recognizing any potential issues and initiating an appropriate interventions to address the newborn's needs promptly. This systematic approach plays a vital role in neonatal care, helping to ensure that every baby receives the best possible start in life. In conclusion, the management of Apgar score is a vital aspect of newborn care, providing an immediate and clear assessment of baby's health right after birth. By evaluating five critical criteria, that is appearance, pulse, grimace, response, activity and respiration, healthcare providers can swiftly determine the need for any urgent medical intervention. Accurate Apgar score assessment and timely response ensure that newborns receive the necessary support to address any health issues promptly. This practice not only aids in stabilizing newborns who may be experiencing difficulties, but also helps in monitoring their ongoing recovery and adjustment to the life outside the womb. Continuous training and proficiency in Apgar score management among the healthcare professionals are crucial for maintaining the high standards of neonatal care. Through diligent assessment and prompt interventions, we can significantly enhance the health outcomes for newborns, ensuring they have a strong and healthy start in life. I hope today's class is informative. If you have any question, please you can put it in the comment section. Thank you.